I just didn't want to go against doctor advice. They already thought I was a neurotic woman who was had anxiety and all kinds of it. I just felt like I was just pushed off. So I didn't want to upset them. I didn't want my male doctors to be mad at me for making a decision that went against them. And so I went home, and I was told later that I was lucky I didn't die that night.
Hey, everybody, I'm Lori Schulweiss.
And I'm Jen Giammo.
And welcome to a very special episode of Everybody Talks, the podcast where we explore the wide world of wellness. Sometimes we talk to experts, sometimes we just talk to each other, but we're always talking to you.
Every week, we discuss topics from nutrition and exercise to mindfulness and self-care. And today, we are doing something a little bit different. We spend a lot of time on this podcast talking to doctors and different experts to give you advice on different health problems that you might want to face or maybe want to avoid.
Well, today we're going right to patients. Thanks to the American Heart Association, we are going to talk with 3 women who are survivors, who are going to share their stories and hopefully change the way doctors treat patients and offer us all hope for the future. So please welcome to Everybody Talks, Tanya Saiz, Molly McGuire, and Robin Eaton. Welcome to Everybody Talks, ladies.
Thanks for having us.
Yes, thank you.
Thank you so much for being here. We have a lot of questions for you.
Right.
But I think we want to start with just hearing of some of your stories. So we'll sort of just go around. Tanya, can you take us back to the moment where you had a stroke, correct?
I did.
So take us back to that moment. What were the first signs? How did you know something was wrong?
So it was an early morning. My daughter and I had plans to go hiking up in Boulder. I was actually out in Colorado. So my stroke happened in 2020. And it was just as COVID had kind of leveled out here in New York. And I hadn't seen my daughter. So we drove out to Colorado. And I had been there for almost a month. And we were going out for a hike, got up early, typical teenager. She didn't want to get out of bed. So I started the motion in the ocean. You know what I mean? And suddenly I saw like a crack of light in my right eye. So like what looked like lightning, just a flash. And, I definitely noted it. I didn't feel that well. And I told her, I'm going to go downstairs. We were house sitting for my cousin. And I was like, I'm just going to go rest, get ready. I'll be downstairs. And in a really short period of time, I started experiencing some really odd symptoms, like my arm was moving, kind of tapping against my body, but I wasn't the person doing that. And then shortly thereafter, I started to get just unsteady on my feet. Let's put it that way. So that kind of B fast, the B before fast in terms of what we learn as the stroke acronym, or what I experienced in terms of, changes in vision and balance. But I really wasn't aware that I was having a stroke. I just knew something was wrong. And we called 911 when I sort of lost, I didn't lose my balance. I sort of just got a little bit weak when I tried to stand. And that's when we called 911. But that's when things kind of didn't go the right way. I was not diagnosed, they don't diagnose the EMTs, but the EMTs favored a panic attack. And when I got to the hospital, they thought I was having just a complex migraine. So they never called a stroke alert. So it took about 3.5 hours before I had a CT scan while I was in the hospital to confirm it was a stroke.
Oh my God.
Wow. But were you, we talk a lot on this podcast about being your own advocate and, kind of taking charge of your own health for yourself. And so at what point, did you insist that something was more wrong than just a migraine? I've had a migraine. It's like, I would hope that I would know the difference between a migraine and if I were having a stroke.
It's interesting because the EMTs asked me if I wanted to go to the hospital, which I thought was just such an odd question. We had called 911. They found me on the floor. Like there were reasons why I wouldn't not take someone. I'm like, you've asked me to the hospital.
Yeah, of course.
So, and I said yes. And I said yes because I was like, I don't know what's happening. Like I can't be. I didn't know I was having a stroke because I was having it. So that was kind of the big challenge. So, but I knew I needed to get help. So yes, I was like, I need to go to the hospital. And unfortunately, in the hospital, my daughter was kind of dissuaded from coming. The EMT said, hey, it's just a panic attack. You can meet us at the hospital later. So she
Wow.
wasn't with me. I didn't have someone who could speak for me or who knew me to say, hey, this is wrong. This isn't how my mom is. Um, so really, I think my self advocacy didn't unfortunately start until I woke up in the ICU. And that's when I
Wow.
found out that I had waited 3.5 hours. And that's when I understood that, like I really needed to be firm when I was feeling symptoms and not be told, oh, it's just her anxiety. I'm like, no, it's not. You know, that's
Oh my
a really
God.
weird buzzword in terms of, I think,
It-
an
Sure
association with
is.
women's symptoms.
Yeah,
Absolutely. I've
absolutely.
heard that before with like heart attack patients as well. They just think like, oh, your heart's racing. You're just having a panic attack or it's anxiety. And it's
Right.
like, I'm sorry, your body, and you know when something is wrong. So once at what point then did they determine that it was a stroke and what did they do to help you?
Um, so 3.5 later, I had the CT.
Mm-hmm.
Then they called a stroke alert. Then they do the whole neurological consults. So I was out of the window for medication,
Okay.
which is actually a fact that I really I recently heard is that women with ischemic stroke are less likely to get urgent imaging and blood thinners. So I didn't get medication. They tried to remove the clot through a procedure called a thrombectomy, where a
Hmm.
Uh-huh.
surgeon goes in through the artery in your leg and tries to remove the clot, but that failed.
Oh
So
God.
I kind of have come to the conclusion that I'm here through no intervention of man. Like I didn't get any help actually, um, but but yet I'm here.
But you're here. Well, thank God.
Wow. Thank goodness.
What a scary, scary
I know.
experience.
Yeah.
Um, wow. Gosh. All right. I have so many questions about that, but I think we want to
I
like.
know. But so let's hear. I mean, I think this is the right way to do it to hear everybody's
Now
because
we're
now I
like,
have questions about you, but then I have Molly waiting and
I
Robin
know, I
waiting.
know. Well,
So let's
let's
hear everybody's because everyone had a little variation of some
yes.
sort of heart disease. So let's go to Molly, um, and let's share what happened to you.
My story, it began during my first pregnancy. I was 30 years old. Um, and so I had, let me take you back. Let me try to, I feel like it's therapeutic for me to tell my story, but it's also it's very triggering too. But I also
Of
understand
course.
the impact that it has when sharing the story. Um, so it started my first pregnancy. We had had some issues with conceiving, so it was through Clomid. Um, and so the first trimester was pretty uneventful. Second trimester, pretty uneventful. Had a 20-week scan. Everything was, on track. Was good to go. We were planning the baby shower. Invitations were about to be sent out, and everything started to go downhill. Um, I started not feeling well. I started swelling, a lot of swelling. Um, I would um, describe myself as getting puffy and feeling ill. I couldn't stop vomiting. I had a headache that was more than a migraine. I remember calling the doctor's office and saying, I have such a bad headache that I feel like I need to give myself a lobotomy to relieve the pressure or
Oh
shoot
my
myself in
God.
the head. Like I was
Yeah.
telling him that I never had a headache that bad, like because I felt like I was dying. And in reality, I was dying because I had preeclampsia at that point in time. And I kept telling the doctor and calling, and they said, no, you have the flu. We have like 30 other women in this area with the flu. And finally, they were like, how about you come in? How about you come into the office and we'll check you out? And so I did go in there, and the office was full of women who appeared to be sick with the flu. But I was like, I don't have the flu. Like, and they were like, well, you've never had the flu while you were pregnant. And I was like, well, I've never been pregnant before. And this is definitely not the flu, but because women would never have a second pregnancy if they felt this bad. So
Right.
I was seen by a medical assistant who took my blood pressure. And at that point in time, it was a little elevated, but nothing major. They took some urine to test it. My protein wasn't up. Um, but one thing they did do was they decided that they do a blood draw. And I really think during that blood draw, if I had known anything about preeclampsia and HELP syndrome, I would have been able to advocate for myself. But when the phlebotomist pulled the needle out, she couldn't stop the bleeding. And it just went down my arm, fell onto the floor, it was pooling on the floor. And at that point in time, I think that was a red flag, like low platelet count, your blood's not clotting. And I even said to them as I almost passed out, that's never happened before. And yeah, they let me leave the office that day. Told me to go home and prop my legs up. And it was just, I don't know how to, I'm trying to think what the best way to
Wait, back
describe
it up. So you were bleeding uncontrollably, but they said, no, go home.
They got the bleeding to
Okay.
stop. They sent me home. I left that office without a fetal Doppler check. So nobody checked for a baby's heartbeat, even though I had told them I hadn't felt my baby move in a few days.
Oh, God.
But they kept telling me that, well, you're bigger. You're in your third trimester. There's not a lot of room in there anymore. You're a bigger woman, because at that point in time, I was about 85 pounds heavier. And I was just like, no, this doesn't feel right. And I even remember leaving the OB office and looking across the street because I could see the emergency room. And I really thought to myself, you need to go over there. But then I was like, so I just didn't want to go against doctor advice. They already thought I was a neurotic woman who was had anxiety and all kinds of it. I just felt like I was just pushed off. So I didn't want to upset them. I didn't want my male doctors to be mad at me for making a decision that went against them.
Isn't that crazy?
And so I went home, and I was told later that I was lucky I didn't die that night. And it was only through the grace of God that the next day I went to work, because they wouldn't give me a note I needed a doctor's note so I could, because I wanted to take off work because I'd already used too many sick days. And they didn't give me a note. So I went to work, but I left work to go to a gestational diabetes education course. And it was at that point in time where they started the meeting out, talking about the 10 top, signs and symptoms that you need to immediately let your doctor know about if you start to experience. And I just burst into tears because I had all 10. And It was at that point that nurse was the first person besides my family and friends who believed me and was like, I'm going to go over to the specialty clinic and I'm going to talk to them. And then the next thing I know, they're like, come in here. We want to hook you up to a non-stress test. And then I remember the nurse, and she was so sweet. And she was like, oh, it's hard to find these hiding babies. And I was like, I'm in the third trimester. This baby is a big baby. It is not hiding. I knew at that point, I just needed somebody to confirm the baby had died. And they immediately came in and they were like, the doctor wants to do an ultrasound. They didn't even give me enough time to zip up my pants, pull anything. I was going across the hall into the ultrasound room, and he came in, introduced himself. And then he was like, your baby does not have a heartbeat. I'm sorry. And it was at that point in time that I allowed myself to break down and cry because somebody had already confirmed what I already knew. And I just needed somebody to listen to me, confirm what I already knew, and then start helping take care of me. Because at that point in time, I didn't realize how ill I was. I didn't realize, I thought I was making pretty good decisions for myself. I'm a pretty smart woman. At that time, I worked in Child Protective Services as an investigative supervisor. I knew stuff. I wasn't dumb. But once you get that sick, you can't make good decisions for yourself. I shouldn't have been driving. I shouldn't have went to work that day. I should have went over to the ER. There were all kinds of things I should have done. But again, I was too ill to make good decisions for myself. So that's why I'm here today, because once you get that ill, you have to have family and friends advocate for yourself. Because even through that process, even after I got upstairs and they started me on the Pitocin to deliver and the magnesium sulfate to bring down the high blood pressure so I didn't have a stroke or seizure, because I didn't even realize that I was close to stroke or seizure until I heard the MD talking to my OB saying, hey, I have your patient in my office on the verge of a stroke or seizure. What do you want me to do? And
Oh my God.
they were like, send her over to across the street to our clinic. And now I'm thinking, why did they say that? Because why didn't they just say send her straight upstairs? But no, they sent me back across the street to the clinic, had me go in the front door, sit with all the other women who supposedly had the flu in the area. Why I knew my baby was dead inside me when I had just been in their office the day before. And then as I walk into that room and I get up, I'm able to get up on the table for the exam, and all I see on the paperwork is somebody has written on my medical chart, fetal demise, big black letters. And at that point in time, I was like, my baby died. I didn't realize it's considered a fetal demise. I didn't realize it's going to be considered a spontaneous abortion. I didn't realize all this stuff. Like, so then all of a sudden I felt like I was less than human. I was now just a medical, like, concern to them, not a human concern. So the whole pregnancy experience and the delivery, I could go into the horrific details of that when it came to, again, people not listening. And then also, I really want to advocate for women to, if you're single, I wasn't married, so I didn't have an advance directive on file at the hospital for medical decisions for myself. So I remember the anesthesiologist coming in to do a spinal, because again, I didn't want to feel any pain. That was, and I kept thinking, this wasn't my birth plan. This wasn't my birth plan. But I was like, why am I signing this paperwork? And they were like, well, once we insert it, because your platelets are so low, we may not be able to stop the bleeding. So you may bleed out and it could kill you. And I was like, well, that doesn't seem like a good idea. So I didn't sign that paper. So I didn't have a spinal. So I had, no medication when it came to delivery. So natural delivery, because I at least had the foresight to think, that doesn't sound like a good decision. But then I'm thinking to myself, why are they allowing somebody who's this ill to make decisions for themselves?
Right.
Yeah, because here, sign this paper, you might die. There, I have like learned so much from this experience that I feel like people just need to hear it, because again, I have 2 daughters now, and I don't want anybody to ever put them in that situation again. I want them to know the signs and symptoms. I want anybody, because even when it comes to my partner at the time, Joe, Michael's father, I feel like he's even been able to pass on information to family and friends, because we did have a mutual family member, or a friend of the family. And he was like, you know what? My daughter-in-law's starting to get puffy like Molly was, and started giving him some more information. And Joe was like, that sounds like preeclampsia. Send her to the hospital. She was in Texas, but they sent her to the hospital, and they delivered her baby that day. And so I feel like the information already has been passed on, even like
saved
locally. So
saved a life.
That's why I'm doing what I'm doing here today. Because again, I just feel like my situation was so horribly tragic and such an horrific ordeal that it happened for a reason, and it's because I'm willing to tell the story.
Of course.
And I want people to hear it.
Thank you for sharing
God,
that.
Thank you.
Oh God, what a
But I didn't even realize preeclampsia and HELLP syndrome were even considered a heart issue.
I didn't know that.
No, I did not know that, and I only know because when I was on the charity team for the American Heart Association for Chicago. And I was on the website. Well, they had a call out for the survivors. And I was like, okay, maybe I have family and friends that meet the criteria. Let me look it up. And then I was on their Facebook page and I saw preeclampsia, and I was like, that's me. I didn't even realize I was considered a survivor.
Yeah, because one of the first symptoms usually, right, with preeclampsia is your blood pressure skyrockets, right?
Yeah.
So, oh my
And
gosh.
it didn't skyrocket until the very end, which I mean, everybody's different when it comes to their signs and symptoms.
Wow. Yeah.
But it also increases your risk of heart disease later on, because now I have an abnormally high calcium score for a woman my age. And when I asked the cardiologist about it, he said, I really don't know, because the research isn't out there for somebody with a score your high, or a woman your age this high. Right. So he said, all I can tell you to do is to keep running, because you're literally running for your life.
Yeah. Wow. Yeah, keep staying active. And oh my gosh. Oh, Molly.
Preeclampsia, by the way, is also a risk factor for stroke.
Yep. It increases my stroke. I guess my risk for stroke is now double.
Yeah. And we don't talk about that. We don't talk about those unique like things that happen during like hormonal changes in our bodies. And like, that is something I only learned that recently. And like, maybe tell someone who had a pregnancy and experienced preeclampsia, because I did, that, hey, this is a risk factor for stroke later in your life, because they don't ask you that, they don't ask about women's health issues when they ask about your medical history that way. We don't dive in that way.
Yeah. Interesting.
The same with the gestational diabetes that increases your risk for type 2 later on.
Yeah.
Mm-hmm.
Oh my goodness. Well, Robin,
You're next.
you're next. You've been waiting very patiently,
and then we're gonna dive into a
then,
million questions.
then we just want to open it up and talk about, well, let's hear, Robin, what happened to you.
Okay, so last December of 2023, I had gotten my boys off to school in the morning. I'd come back to my house, and I immediately started to experience some pain, like stabbing chest pain. My arms became tingly, and my back hurt. So I was like, this is really odd. So I took some Tylenol. I tried to lay down, became very uncomfortable. So I tried to stand up, sit down, like nothing was working. And I started to kind of just get very nervous. And my instincts kicked in, and I was like, this is really strange. I actually Googled my symptoms, which of course you're not supposed to do. And the worst thing comes up, says you're having a heart attack. And I'm like, okay, I'm not having a heart attack. But after like 10 minutes, I was like, okay, this is not like, I took some Xanax. I was like, maybe it's panic attack. Like nothing was happening. So I just called 911, and I didn't even think about it. Just called it. And I said, these are my symptoms. They said, okay, we're going to send somebody out. I was home alone at the time. So I called my neighbor and my friend Mary, and I was like, I don't know, something's wrong with me. Can you just come down with me? I called 911. The ambulance is on their way. She's like, oh my God, yeah, I'll come right there. So she comes over, she sits with me. The EMTs come in, I tell them my symptoms, and they take my vitals. They take my, my oxygen, my temperature, my blood pressure. Everything is normal. They do an EKG on me. And the EMT says to me, well, good news is you're not having a heart attack. And I was like, oh, I thought to myself, well, good, because I was crazy. I just thought I was having one, so what's going on? And he said, well, your vitals look fine. So it's really up to you what you want to do from here. Like we can take you to the hospital. You could take your own car. You could stay here. You can call us back in a couple hours, So I was like, so you think that it's okay if you guys leave? And he was like, yeah, I mean, everything seems fine. So I was like, all right, well, now I just embarrassed myself because I've got this ambulance out front of my house. So they left.
Wow.
And I sat there with my neighbor, and I was like, Mary, like, I was like, something's just wrong. Like my gut is telling me something is wrong. And she's like, well, do you want to call your family doctor and see what they say? I'm like, they're just going to tell me to go to the hospital. And she's like, why don't we just go? So I'm like, all right, maybe we'll just go, because maybe they can do like blood work or some other test that the EMTs can't do. So she takes me to the hospital. On the way, my hands become numb and the pain becomes worse. And it got to the point where I was like, can you drive a little faster? She was like, oh, geez. Okay. So I get to the hospital. They take me back and they triage me. The nurse, she doesn't even check at anything, like my weight, nothing, none of that. She sits me down. She's like, we have to do an EKG. I said, I just had one at my house like 20 minutes earlier. And she's like, no, I have to do one here. So she does it. She looks at the results and she's like, I have to go get a doctor to read this. So I say to my girlfriend, my neighbor, Mary, I was like, well, that's not good. And she's like, well, we don't know yet. Like it's just protocol. She comes back in, the nurse comes back in. She's like, grab all your belongings. Things are going to be moving very quickly. So at that point, I go into this huge room with a crash cart, and there's doctors and nurses everywhere. And I'm like, well, this is a big change from this morning. So I'm laying there. They're taking they're taking blood. They're doing ultrasounds. They're doing all these different things. And that's when the cardiologist comes in, and he's like, it seems to me that you're having a heart attack.
Wow.
And I think to myself, like, how am I having I'm like so young. Like, how can I have a heart attack? I just lost, at that point, I was on a weight loss journey. At that point, I had lost 80 pounds.
Wow.
So like, why is this happening to me at such a young age? So fast fast forward, he does a catheterization. He finds out that I have this very, very rare heart attack. It's called SCAD, spontaneous coronary artery dissection. It happens to mainly women in their 40s and 50s with no other cardiovascular issues. So I have no plaque in my arteries. My blood pressure is actually very low. So I seem pretty healthy, but what happened was my artery had dissected. So basically the interior of my artery tore and then caused a blockage, and that causes a heart attack. So that's basically what had happened. But I was dismissed by the EMTs because I'm young. I look very healthy. I was just I wasn't complaining about my symptoms, but I feel like had I been an 80-year-old man and said that I had classic heart attack symptoms, stabbing pain, numbness in my arms, pain in my back, they would have put me in that ambulance and taken me right to the hospital.
100%.
But because I'm young and I'm a female, they basically told me I was fine.
Yeah.
Do they know what causes SCAD?
So SCAD can be caused by, a lot of people have it after they give birth. So I actually have fibromuscular dysplasia. So fibromuscular dysplasia is a weakening of your arteries. It can cause stroke, aneurysms, dissections, heart attacks, death. Another thing that happened to me was, I'm a very big advocate about trust your gut, do your own research and question your doctors. And so I had been to this cardiologist, and she's like, we're going to test you for fibromuscular dysplasia because 50% of women that have SCAD also have this artery disease. So I said, okay. So she sends me for a ultrasound of my carotid arteries in my neck. I get the test results back, and they come back that I don't have it. So we're still kind of like, well, I wonder why I had this. We're trying to find out the reason why I had this heart attack. When I was meeting with her, SCAD is very rare. And I had asked her, because I question all my doctors, how many patients do you have that have SCAD? Because she was actually not the cardiologist in the hospital. They referred me to her as a SCAD guru. I said, how many patients do you have that have SCAD? And she said, in my career, I've had 6.
Wow.
So,
wow.
Oh my God.
Well, because it's very rare, but she doesn't treat it very often.
Yeah.
And it's treated very different than a classic heart attack.
Yes.
So through more research, I found another cardiologist in the city of Philadelphia. So I went to her, and she said to me, have you been tested for fibromuscular dysplasia? I said, yes, my last cardiologist did an ultrasound of my carotid arteries. And she said, oh, no. You need a CAT scan. You need a CAT scan of your head, your neck, and your abdomen. And I said, okay. And I kind of knew that because I had done some research, but sometimes you have to listen to doctors. So she did the CAT scan, and it came back that I do have fibromuscular dysplasia. So I have it in my carotid arteries, and I also have a brain aneurysm. But had I not kept following more doctors and questioning, and I would have not have known that, and I would have thought that, I was tested for it and I'm negative. But so that's the reason why I had my SCAD.
Okay. All right. I want to ask a question
Okay.
to all of you guys. I want to get into like the physical and the lifestyle components of this, and then also I want to touch on the emotional aspect, because this,
Of course. And
hearing
then
all of your stories is like
it's so like
taking my breath away.
Yes. I mean, Jen is so empathetic. Like, I feel every time you guys spoke, I know what's happening to her. Not that I'm not.
Just tough as nails. This one.
I'm not tough as nails at all. I'm a big mush. And but
before we get
yes.
into that, I kind of want to talk to you guys about what have you done since these experiences? What changes have you made in your lifestyle, whether it's from like a fitness perspective, nutrition perspective, just, anything that you are now doing differently than what you did prior to these incidents?
I think I know some of their stories, and I think that they've done a great deal more. For me, learning about, stroke is to some degree, right, preventable, right? There are certain lifestyle changes that are very universal in terms of what we can be doing. So healthier eating habits, making sure that you're being active, don't smoke, please, for all
Sure.
kinds of reasons.
Yeah.
So for me, growing up Cuban, trying to actually get our family's lifestyle to change has been like a tremendous challenge. But, really convincing my mom that, you don't need rice every day. You don't need certain things in your
Yeah.
life. Trying to be an anti-inflammatory protocol has been really good for me personally. That's helped a lot. I was told in acute rehab for maximum brain recovery is pretty much how I remember them telling me, you know, uh, give your brain a year, stay sober, don't do don't, partake in anything really recreationally. Cause I had used, medicinal marijuana before for pain management for a back injury. And I was like, dang it, you got that. I'll be sober. You know what I mean? I was like, maximum brain, whatever you tell me to do. If you tell me I need to stand on one foot as long as I'm human, whatever you tell me to do, I'm doing. So changes like that have really helped. And I think just understanding self-care is important. I think as women and as moms, we don't see our own care as being the priority because we want to care for everyone else. But understanding that without self-care, we won't be here for those other people. So
That's right.
being greedy, because it feels greedy, and we're kind of taught that it is greedy. But really adopting self-care has probably been the biggest change for me in mindfulness, just, allowing myself to exist
Yeah.
and have space.
Yeah. Good for
Sure.
you. Yep.
Sure. I mean, Robin, you said you had already been on a weight loss, journey that you would think that you'd be in the
Yeah.
picture of health after losing
Right.
80 pounds, right?
Yeah. So at that point, I had lost 80 pounds. In total, I've lost 110.
Oh my gosh.
Yeah. So so I definitely had, I exercise regularly. I have a personal trainer that I see. But just having this happen to me really solidifies that, like, I need to keep up with that. I need to, I can't miss a gym day. So to eat right. Also, my mental health has gotten, sometimes mental health after these episodes, people can go into a depression, but really it's kind of like flipped me. I've become more of a very positive person. Anything that's negative me, I'm just like, I don't have time for that. I have to focus. These are, I could not be, I might not be here today. So I just try to live a very positive life and take every opportunity I can, and don't say no to things that are, could, open up other doors, and just, yeah. So I also, so I'm a hairstylist, so I see many women every day. So I also communicate with them about their own heart health and symptoms, and, to go to your doctor. You take your kids to your doctor. You need to go to your doctor. I've actually, in the past year, I've had 2 clients that had heart attacks. One was a client herself had a heart attack, and the other one was her husband. And just because of me speaking about my journey and symptoms, they got help immediately. So,
Wow.
that's 2 people right there that,
Amazing.
yeah. So,
Yeah, it just brings that
Yes.
awareness, it
Yeah.
makes people more aware,
Right.
just hearing what happened to you, and you just, not that you want to be on high alert all the time, but you want to recognize when something doesn't feel right. Yeah.
Right. Trust your gut.
Totally.
Mm-hmm.
Like as a, look, we don't have children to um, eat up our time and our attention in that way. But it's like, even every woman just ignores everything. I mean, I wake
Oh,
up
yeah.
every day with some sort of pain. It's just like a
Yeah.
fact.
That's just old. That's
It's just
called
animal.
old.
Animal.
That's what I
But,
think. Is it menopause? Is it this? They're like,
is it this?
stop,
Is that?
right?
There's so many
No.
things. You're like, oh, so my knee hurts today. Who cares? So
Yeah.
my elbow hurts. So and you just don't pay attention or want to get those things checked because you're like, oh, it's fine.
Or you think that you're healthy, like, Robin having lost
Yeah.
the weight, and, obviously you were following a nutrition and a fitness plan to begin with. And, same with me. I feel like, well, I'm so healthy. What could happen to me? But it could happen to anyone.
Anyone,
Right.
And then Molly, like how scary was it to, like you say, you have 2 daughters now. So obviously how, I don't know if scary is the right word, but how apprehensive were you about trying to conceive again?
Well, I can tell you, we weren't very apprehensive, just because we have a maternal and fetal medicine specialist in our area who's fabulous. And so after the loss, we had genetic testing done. And so I felt a lot better because he knew, that he knew the situation because he was the same doctor who had told me that Michael had passed away. But he also told me that he was going to be there for me and he was going to take care of me and he was going to be there every step of the way. And so we got the green light to go 6 weeks after.
Wow.
And we were pregnant within, I forget, 6 or 8 weeks. So Michael was born in January 10th, 2009. And then Jolie came November 27th, 2009. So
wow.
super quick. Yeah.
Okay.
That's amazing, then.
But I feel like we had the support we needed. And I felt like I was a partner with my medical provider. When any decision he was making, he let me help. So he said, you had gestational diabetes. He's like, we're not going to do the testing. We're just going to, do you feel comfortable with just me treating you as if you have gestational diabetes right from the get-go? And I said, yes, let's do that. And then when it came to the insulin, he let me do my research and do my number. I said, I think I need to increase this. I did all that. If I saw anything regarding preeclampsia, because at that point in time, prior to the stillbirth, I wasn't on any kind of social media, no babycenter.com. After that, I was like big into it. So if I saw any new research, I brought it to his attention. He would read it and we'd talk about it. So, and he also saw me like every week of the pregnancy and did an ultrasound every week of the pregnancy. So it was,
So you felt really,
I
that's
felt
like
really
a level of
comfortable.
confidence that I don't think a lot of women get.
I mean, and what a difference when a doctor is on board.
Yeah.
Like that. I mean, obviously the common denominator in your 3 stories was being kind of ignored. Like doctors and EMTs and people were ignoring what seemed to be right and staring them in the face. And so how
just
important it is.
dismissive, like very dismissive. And, like you said, Robin, if you were a man having those same symptoms, you would be, be back on your feet probably within a few hours.
Right.
But that's frustrating. And we've, like we've said, we've talked to so many doctors on this podcast and we feel like, I don't know if this is true or if we're just, in this
we feel like we're in a bubble.
But it seems like that's changing. And it seems like women are getting, feeling more empowered and asking the right questions and knowing what to ask, but at the same time, there's still a lot of people who are afraid, they're afraid to voice their opinion, or it's like, I'm going to listen to the doctor because he's a doctor, she is a doctor. And of course, they know what to do.
Right.
But
it's generational, right?
It is.
Generational.
It is.
100%.
I love what Molly said about having a partner. And I feel like, and I think you all would probably agree with Robin and Molly, but like, if my doctor is not on board with how I want to take care of myself, they're fired from the team. And you can fire your doctor. You can say,
I'm on my third cardiologist right now.
Oh my God, that's
right. You're not a good fit. With respect, I'm moving on. You don't have to, it's like that. You don't have to stay chained to someone who doesn't make you feel good. I just changed physiatrists. I hope they don't see this, but my physiatrist, my original physiatrist, I loved him. And he did similar to Molly. I'm like, hey, here's this research about stroke recovery. And he would either be familiar with it or he would read it. We would talk about it. And I felt like a partner in my care. And, like I said, he left. I had a new one, not the right fit. And I just, had to move on. And it's okay to do that. You have to really have the right people on your team.
Yes.
Yes. I mean, I'm going through something much less life-threatening. But I finally, found the right doctor, and I was leaving her office the other day, and she literally said to me, if this doesn't work, I have other things, that. And so it was just like knowing that she wasn't going to give up. Like she thinks whatever she prescribed for me is going to work, but if it doesn't, it wasn't the end. It's not the end. We're going to fix whatever ails you. And it's,
And that's the kind of support that you
oh
need.
my
I feel
God,
like
it makes such a difference. I mean, I hate the phrase, I need to be seen. I really hate it, but that's the way I felt. And
You
that's
felt
the way you
seen.
should feel
Yeah.
whenever you walk into your doctor's
Yeah,
office.
absolutely.
I told my any doctor I have now, like, I've had this experience and I do not want to ever have it again. And if I ever get to the point where I feel like you're dismissing me, I will fire you. So I let
You're
them know
on
right from the
notice.
get-go.
You're on
Yeah.
notice.
Yeah, right. Put them on.
Totally,
But that's so
totally.
true. I just think about, how we are afraid sometimes. I mean,
Definitely.
I used to be afraid to like change my hairstylist. I'd be like, oh, I don't like her, but I have to stick with her because I don't want to tell her that, you have to voice your opinion or your concerns or whatever it is. And who knows, if you were to say that to a doctor and say, look,
Right.
maybe they would kind of, change their approach.
Right.
Or if
More
they don't,
embrace,
then
embrace what you're saying.
Yeah, if they're not going to be able to, because I'm very vigilant, hyper vigilant about things. And so if they're not going to be able to handle that, then it's not going to be a good working relationship.
Right.
Yeah.
Right.
Totally.
And if you're not comfortable to bring somebody with you to those appointments who is, who can be an advocate for you if you don't feel,
yeah,
which
1000%.
I'm that person all the time.
Oh my gosh. You don't want to be, look, I'm happy to have her
no
because
one wants to be
if
at the
I get a
doctor
blood
with me.
test and I'm like, okay, what do all these things mean? Will you tell me what all these things mean and what I should like watch out for?
Well,
she's a person you do want to have with
I just don't like, and sort of, all of you guys were saying like you did a lot of your own research and you have to, and I actually enjoy doing that. My dad was diagnosed with cancer a few years ago and it recently came back. And so, we've been to countless doctors and, there's so much new research that these, talk about generational, that these doctors are not even aware of. So I would go in there literally with my stack of research papers and say like, what about this? What about, and I will say we did have a few doctors that were like, well, he's not eligible for that because of this, or, they were answering my questions. I'm sure they were like highly annoyed by
trust me, they were very annoyed. They were very annoyed.
But, if you're not, you have to do it. You have to do it. And you learn a lot through that process too.
Yeah, I come in with a lot of questions, and I think my cardiologist, I probably ask way more than anybody else. And at one appointment, she's like, "Why do you want to know this?" Like,
right?
I mean, I want to know. It's happened to me. Like, I want to know everything about what's happening to me.
Why wouldn't you want to know?
But what I love about her is she doesn't rush me. You know what I mean? Like, she's not like, I have another patient, which is another reason why I love her. She takes, she'll answer all my silly questions, and that's a good doctor for you.
I did research because I had the What to Expect When You're Expecting book, and I went to the complications section, but it never mentioned preeclampsia in the version I had. It was toxemia, they mentioned, which is what preeclampsia used to be called. And I even mentioned on the phone, I think I have toxemia. I said I had a friend that had it, and I'm having the swelling and the same issues. And again, that didn't even prompt.
Nobody.
So
wow.
I wasn't lucky enough at that time to have, the online researches. Mine was 2009, so right before everybody kind of went online. But even the books they give you, which I think everybody, all women who are pregnant usually have that. It's like their pregnancy Bible.
I was just thinking, and I'm sure it extends to the other women in the class as well. But when you've been dismissed, and I unpacked this a little bit with a friend of mine because she was like, "How do you know so much?" She's like, "What happened? Tell me everything." And I was going through like my diagnoses and I'm like telling her everything, I had a PFO and then I have a clotting disorder and blah, 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 blah. And she's like stunned. And she's like, because I don't have a medical background, although I sometimes say I'm medically blonde. But when you've been dismissed, the way I think some of our healing happens is by empowering ourselves and getting the research and not wanting to ever see that happen to us again. So you're like, I'm not going to walk in blind. Like, I'm going to make sure I understand everything. I mean, God bless Google and Alexa. I would sit there with my medical records and be like, Alexa, what do you use this medication for, to understand what did they do to me? And especially because I don't have memories of the hospital. I have like 3 memories of being in the hospital, and I was there for 3.5 hours before the action actually occurred.
Wow.
So I don't know what happened to me. So I read my medical records. And if you can imagine doing that, like, a couple of months after your stroke, you're like, maybe not the best eyes and brain for it, but I wanted to understand.
Yeah,
I was
of course,
hungry to understand
yeah.
what happened to me, because it just was, it was terrible. And I didn't, and I think
Yeah.
our healing and our power comes from becoming knowledgeable and our self advocacy
Absolutely.
and wanting others to not walk the path, right? So, like, making
Yes.
sure people understand, what happened, what you can do differently, how can we help you not experience our pain? I feel like that's what I'm hearing from, Robin and Molly too. And it's just like, we just don't want anyone else to have to go through this or have a different outcome. We're so lucky.
Yep.
Yeah.
Knowledge is power.
Exactly. I mean, we all attended at the end of January the Red Dress collection from the American Heart Association, and there was nothing more inspiring than to see all of you survivors there with your red dresses, speaking out, being symbols of,
Hope.
life,
Yeah.
hope, and also knowledge, and also a I don't want to say warning, but like a lesson to be learned for those of us who haven't experienced those
Yeah.
things. I mean, it's really extraordinary what you guys are doing
Yeah.
now.
It's also great. We have found like our support system, like, the 12 of us are, we're going to be bonded for life, but, so we have us, but then, I think it's very important to find other support systems, whether you have a stroke or HELP syndrome or heart attacks, and just bond and, really become friends and learn from each other, and know that you're not alone, which is really important.
That's a bond that is so special, and you guys will have that for the rest of your lives. I
Right.
mean,
Yeah.
that is
Right.
really, I wanted to talk about that a little bit. You mentioned sort of mental health and mindset. Like, how has your mindset changed after going through all of what you've gone through? You had said that you have more, Robin, that you were more positive. Have you guys had like any big shifts in that?
I think I'm also very positive when it comes to um, my outlook on life. I don't take anything truly very seriously. It's just once you've been through a near death experience, everything's just kind of like, I'm here. I'm going to enjoy it. I like Robin said, she doesn't have time for that negativity. I've also learned to say no because I did have severe postpartum depression to the point the medical doctor said, if Joe wasn't here with you, you would be going to the psych ward right now. And so I did 12 weeks intensive outpatient counseling, which I think was life changing. I truly needed to spend that time, like that self care, and take care of myself, take care of my mental health, um, because it truly affected me, like the loss, the experience. I was diagnosed with severe depression, post traumatic stress disorder, and anxiety afterwards. And I'm sure Joe was too, but nobody reached out to him. So I always want to push, like, I was the maternal side of the story, but 50% of it was paternal. And he did not get that um, opportunity. So I really want to stress to like medical professionals, yes, you're taking care of the mother, but also look at the other partner because they're dealing with the loss of a child, but also they almost lost their partner. So please reach out to them and take care of them too.
Yeah. The year that I had my heart attack, I also had a divorce after 15 years. So it was a tough year, but I was not going to let either of those define me. So it's funny now, people are like, wow, you're such a happy person. And yeah, so I had to dig myself out of that hole and yeah, just try to be very positive and have better mental health for me.
Yeah, going through something like that, it obviously changes your life, but you also, anything else that comes after it, I would think, is kind of insignificant, right? It's kind of like, oh, that's not that big of a deal. I almost lost my life.
Yeah,
So
exactly.
not to discount a divorce, we've both been through
We
them.
both have been
Absolutely. It's all for the better now, but yes,
Right.
definitely,
Yeah, it's not fun while you're going through it.
No.
But I do tell people it's like a bereavement cycle. Like, because when they say you're in that bereavement cycle, you're always in it. You're just in one stage of it or another. The same thing when it comes to like my pregnancy loss it's a cycle. So there will be a day where something may just cause me to break down. The depression, might cloud my day and I start to have those negative thoughts, but it's knowing where to turn for the support that I need in order to crawl back out of that hole and keep on going.
Yeah.
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 The support system is huge.
I've worked a lot with my therapist around identity. And I think, Robin, you said it, like how something defines you, and kind of when you're first coming out of something and you're much more thinking, you're kind of like, I'm a stroke survivor, like my stroke. And it's something that's very present, and working through kind of like what that means in the greater scheme of things as you're able to do more, as you open yourself up to more opportunities, you kind of recalibrate and you see that, it's less of my identity, and you try to work through, because depression, I think, is very common. I would imagine, I know it is high for stroke survivors. Anytime something changes your life, you've got to wrestle with, like, what do I have to do differently? How does, like you said, a near death experience, or not even realizing it's a near death experience. I think I still struggle with that. Molly, you said by the grace of God. And I said that one day.
Yeah.
And somebody's like, if you say by the grace of God, it means like you almost died. And I was like, does it though? And I'm just like, I don't, it's very hard for me, I think, to understand that. It makes sense. But like, I think we all agree that, we have to maintain, like, we're the only ones who you can only be in control of yourself, right? And your outlook. You can't control other people. So I think mindset, I'm actually a mindfulness facilitator for the Love Your Brain Foundation. And that organization supports people with brain injury. And I think I was a participant. I've been a participant many times. I dip in all the time. But becoming a facilitator has been an important part of my journey, because just being aware, just taking a moment and saying, what's around me, just, kind of that grounding that it provides, slows everything down and like allows you to just kind of exist, just, sort of, and really connect with yourself, and I think that's another maybe trait that I've noticed in all of us, that we are all very much aware of ourselves, after our experiences.
Yeah. There's a resiliency that you obviously all of you have, but I think, when you say by the grace of God, and you don't have to be religious to say that or believe that, I think that it's so true, because think about each of your stories. You could have gone home and, you all were dismissed, right? There was some sort of, to me, divine intervention that prevailed, right? That made you, all of you, here now today.
Yeah, I think that.
Right?
I think that,
I'm a true believer in that. Whatever you believe in. I think that,
Jen and I are both strong believers of everything happens for a reason, which sounds trite, but is actually true. And that there's no coincidences that,
and then what you do with that, what all of you are doing with that now, that second chance that you have, it's like, maybe these things happened for a reason, or not for a reason, but so that you can advocate for other people, so that you can create awareness, that you can do all these things. I mean, it sucks that you had to go through that, but there was a reason why, you were chosen to do that. So,
I mean, just looking at all three of you now, I mean, it's inspiring to me, just sitting here. So,
and you all look so amazing. Like,
you do.
There's something there that I don't know. There's a secret that you're not sharing with us. That is like, they have great skin and great hair.
Well, those gift bags they gave us did have some.
Right? Oh my God, that's so great.
Oh my God, 1000%. Is there anything any of you want to add before we wrap things up, or any final thoughts you have?
I want to add that I did have a third pregnancy, and I started to show the early signs of preeclampsia. And again, I was seeing the doctor weekly, and he came to me and he said, I got your test results back. What are we doing today? And I said, we're going upstairs and having a baby. And he said, yes, we are. And so she came, I think it was 4 weeks early. So I had to get some steroid shots right before I went upstairs for lung development and stuff. But he was there. Another reason for getting pregnant so quickly afterwards is that the risk of preeclampsia, studies show that the sooner you have another pregnancy, the subsequent pregnancy, the lower the risk for preeclampsia again.
Oh, that's
okay.
interesting.
I didn't know that.
Yeah.
Interesting.
Wow.
So that's why we were like, okay, let's do it as soon as possible.
Yeah, good for you. Good for you to not be, afraid and just,
yeah.
I think
I really didn't know that I should be afraid because it wasn't until that consulting meeting that we had that he said, I didn't think I'd ever see you again. And I was just kind of like, he was like, you were so close to having a stroke or seizure. Like, I thought for sure, like, if you didn't make it, you'd be in a nursing home for the rest of your life. He said, I'm
Oh,
surprised you're not
God.
like laying on his shoulder, drooling on him right now. He's like,
Wow.
he's like,
Holy
I want you
smoke.
to know that's how close you were. And I was like, I
That's a
did not know.
wake-up call, right?
That
That's a
is
wake-up call.
definitely.
Are there any like final words or like of advice that you would give to someone? I know we talked about self-advocacy and things, but any other advice you would give to someone who's maybe recovering from, a stroke or a heart attack or anything like that, that's maybe struggling a little bit more than you guys are now?
The support groups are out there. Like, reach out. I know in Indiana you can call 211 or 988 and get information for a support group.
Okay.
Wow.
Mm-hmm. Yeah, I mean, I am very thankful for the American Heart Association and the Go Red for Women campaign. Through this, I never knew that, cardiovascular disease is the number one killer of women today, even more than all cancers combined. And that is crazy to me. I didn't know these numbers before I had a heart attack. But the Go Red for Women campaign it's just amazing that they bring awareness of women's cardiovascular health. And there's a lot of information online. There's Facebook groups, their website. So I just encourage people to reach out and find other people for support and advocate for yourself and trust your gut.
Yeah,
Of course.
that's great.
Tanya, what about you? Any final thoughts?
Yeah, I mean, I would agree with just definitely that last statement that Robin made about trusting your gut and just putting, giving yourself time, managing your stress, understanding that you matter most in the care of your family. So self-care is important. And, if something doesn't feel right, don't ignore it. And if someone tells you that what you're feeling isn't what you're feeling, fire them, go somewhere else, and don't let that be dismissed.
Yeah, you're the expert when it comes to your body.
That's
Yes,
right.
that's
Yeah.
exactly right.
Yeah.
That's exactly right.
Oh my gosh.
Oh my
Thank
gosh.
you so
Thank you
much.
so much, Robin,
Thank
Molly,
you.
Tanya. Thank you for spending the time with us, sharing your stories, giving great advice.
Such an inspiration.
Such
all
an
of you.
inspiration. Thank you so much for being here on Everybody Talks.
Thank
you.
you.
Okay, so we just heard the inspiring stories of 3 survivors, and now we're going to dive into some of the science behind heart disease and how to recognize the symptoms. Here with us today is a distinguished cardiologist with over 30 years of experience specializing in women's cardiovascular health. She serves as the Senior Vice President for Women's Health and the Executive Director of the Katz Institute for Women's Health at Northwell.
She's been a passionate volunteer with the American Heart Association for more than 3 decades, contributing her clinical expertise and advocacy to advance the organization's mission, and she received the Women Heart Wenger Award for Excellence in Medical Advocacy in 2023. Please welcome to Everybody Talks, Dr. Stacey Rosen. Thanks for coming on and kind of giving us the facts about what women should look for. We talked to Tanya, who had a stroke. We talked to Molly, who had preeclampsia, and we talked to Robin, who had SCAD, a heart attack at a very young age. And so in speaking to them, when they first called for help, all of their diagnoses were missed in some way.
Some were told they were having a panic attack. Others were, all these different things, but they were very much dismissed because they weren't men over 50, probably.
Exactly.
Right?
So maybe you could speak to why those were missed and what to look for.
So, no, and thank you. First, before I even get to answer that important question, let me thank you both, because so much of what we do in the American Heart Association and my day job at Northwell is educating and empowering women to be healthier. So heart disease remains the number one killer of women, but only 45% or fewer of women know that. And we always have had for decades this male model. Women don't get heart disease. When they get it, it's not as bad, or they get it only when they're old. So imagine this, perfect storm of women not thinking they get heart attacks and strokes, the medical community not thinking women get heart attacks and strokes. Sometimes their symptoms can be a little bit different or unusual, and so they get minimized. They often call late. And when they think it's something, we take care of everyone else. We don't want to focus on the possibility. So we minimize our symptoms. We blow them off as something stomach pain, or, I slept funny on my hand. And then we get to healthcare world and we come up against this assumption that women don't get these conditions. It's all in your head. It's anxiety. It's stomach upset. So it's this perfect storm of miscommunication and misunderstandings.
Yeah.
Yeah.
And then also, Dr. Rosen, on the flip side of that, I feel like sometimes at least for me, I always think like, oh, am I overreacting? Maybe
Right.
it is nothing. I think that's, to your point, it's like we don't think of it as something that would happen to us, right? So when would people know, I guess, when would be, what would be the first sign for someone to go to call 911 or to go to the ER versus just, it really being heartburn or something like that?
No, absolutely. So let's start with the fact that the majority of women have risk factors for heart disease over our lifetime. So think how much better we are to identify these things early, do everything we can to prevent heart disease and stroke. And most of it is preventable. So we tell women, even 18 to 30, start learning about your heart health. Know your family's history, know what risk factors, know what things you can do to stay heart healthy. Expect that your doctor, your clinician will give you the opportunities to get ahead of it. You don't even want to, we start by not wanting to wait till we get symptoms to then try to figure it out, to decide who your doctor is. I tell women to go for regular checkups. If as young women, our doctor is our gynecologist, you can still expect your gynecologist to ask about family history, check your blood pressure, your blood sugar, your cholesterol levels, do all those things. Talk about good sleep habits, stress reduction, eating smarter, moving more. So then over a lifetime, you make a partnership with a doctor that really knows you. And that when you call and say, I'm having a little bit of heartburn, if I know you, Lori, Jen, over years, we can ask the questions. I can know what your risks are. And finally, I always tell women that you're better off thinking it could be something bad and, going to the emergency room, calling your doctor, and then we could laugh at it the next day if it just requires a little bit of Tums or, a little less coffee at night, as opposed to the other. Call and ask the question.
Yeah, better be safe than sorry. Now, it's true. Is it true that women have different symptoms than men when it comes to heart attacks?
Yeah, so that is a great question. So women and men are both equally likely to get chest pain. And women, we don't like the word pain, so we'll call it pressure or sticking. But women, as opposed to men, are more likely to get other things, either separately or with the pain. And because we don't want to think that this can be the heart, and clinicians will, minimize or gaslight us, we focus on a little bit of shortness of breath or some back pain. I've had women who feel that their jaw feels funny, that they've gone to dentists rather than ever, consider that this could be from the heart. Early signs of a stroke can be tingling in the face or the hand, and women may have that along with other things. Maybe you did sleep on your hand. So we used to call them atypical, and they're not quite atypical, but they're often in combination with the usual. So it makes women less apt to think it's their heart.
Yeah.
I've heard people say that the pressure that you feel is like if you feel like you want to rip your bra off, you know that something is not right. Like if you have that compulsion.
Oh, really?
Yeah.
I always want to rip my bra
I know.
off.
I do for other
And
reasons.
that's why maybe if it's new and it's an old bra, you might not call, right?
Yeah,
So
right.
It's knowing your body. For some women, it's a little bit of fatigue. For some women, it's a little bit of back pain. And then, it was a bad yoga class. There's always this inclination. And think of how we are when we're advocating for our families, right? We're like lionesses with children, with siblings, with parents. But somehow when we're taking care of ourselves, we put ourselves in the back a little bit. And that really has to change.
Yeah,
Yeah.
absolutely. And I think women too are just a little bit more, have a higher tolerance for
I know.
pain and things
Right.
than men do. I mean, I think we can
Absolutely.
all,
I
we can
know.
all attest to
Totally.
that.
I think we can all.
A lifetime of menstrual periods, and for some
Right? Yeah. So then you talked a little bit about, being proactive and having this healthy lifestyle and things like that. How do you know if your heart is in good shape? What are some of the tests that women can do or people can do to know if you're at risk?
Yeah, no, that's a great question. So, we all know that we get a mammogram starting at 40 or earlier. We get colonoscopy at 45. For the heart, it's not one test, so it starts with heart factors, right? So on a regular basis, you want your blood pressure checked, your cholesterol, your blood sugar or hemoglobin A1C. You want to look at your weight and even your waist circumference. Over a lifetime, you may need some simple things, an electrocardiogram, an echo, or an ultrasound. There are certain stages that we suggest stress tests and other things. I'm a big fan of a relatively new test called a coronary artery calcium score.
Yeah, I just heard about that just recently.
Yeah, it's a special CAT scan. It's very little radiation. It's not even any dye, so you don't need an IV. And it gives you an additional piece of information about even the beginnings of some plaque in the arteries. It's not an expensive test. It's often covered by insurance. So all of these, possible diagnostic tests, you want to ask your clinician about them. Am I a candidate for? Would there be value? When do I get a stress test? Because there's no one size fits all the way we have, recommendations for mammograms or
Yeah.
colonoscopies.
Yeah, I was curious about that, about the calcium score. I have a few clients who had been diagnosed with high cholesterol, and then they went and had the calcium scores, but they were clear. So is it, I guess, can you request those tests even if you're not seeing, these other risk factors?
No, absolutely. Absolutely. And there's a lot of data that the incremental value from a calcium, artery score can help in risk adjust. So maybe your cholesterol is a little high, but your score shows no plaque. Or maybe the opposite, that you're already making plaque when your score is not so terrible. So it's an important piece of information. There's relatively little risk. And it's actually a test that's not particularly expensive. So it's something that is, available for individuals, even if it's not covered by insurance.
Okay.
Sure.
And it's non-invasive. It's just like a
Yeah.
CAT scan type thing.
Right.
Yeah.
Yeah. I
Exactly.
think
Probably
you
less
can do it.
radiation than a flight
Yeah.
to, the West Coast. So,
Right.
Yeah.
Right. Okay.
Now, what about healthcare providers? Like when we talk to these women, it was the EMTs, it was the doctors in emergency rooms that missed what was actually going on. How can that education change so that people have like a wider net of what could possibly be going wrong with you?
Yes. So we focus on education in two lanes. One, we go, as we say, straight to the consumer, right? So what we're doing together today, I know will empower people to not accept, that kind of gaslighting or disrespect that so many women get. But then we also go to the clinicians, everything from our EMTs to our frontline nurses to our physicians, that women get heart disease and stroke. They can present unusually or at very young ages, and always give women the respect and the evaluation that you would give someone if you thought that this was something that was real and very dangerous. So we think of those education straight to consumer, our public. Each of us is a patient also, but also to our professionals who care for these women at every stage, so that they should know that these stories are real and they need to be treated, as such. And again, if the end it turns out to be, the bad Mexican food someone ate for dinner, that's okay. But to be cautious and, persevere in getting the care that you need.
We also talked a little bit about, as women age and hormonal fluctuations and changes that we experience. I know for me, I never had high cholesterol my whole life, and now I have elevated cholesterol. So that's something to be aware of, right? Like what do you see in terms of that, and as far as like hormonal changes go and those those risks? What can women do to mitigate that?
Yeah, no, thank you. That's a great question, because in the heart world, we focus on different milestones or stages in a woman's life. Even something as if you're a young woman who gets her period very early or her period late, if you have a condition called polycystic ovary, all of those things in young women can change their risk factor calculation. When we hit pregnancy ages, there are all kinds of things that can happen during a pregnancy, even if they resolve afterwards, that puts a woman at high risk. And we want to know that. And then finally, we hit that age where perimenopause estrogen starts to drop in our bloodstream. And that naturally causes a change in our blood pressure. More women develop hypertension. The estrogen keeps our bad cholesterol lower and our good cholesterol high. And when we lose estrogen in our bloodstream, we get naturally, we're predisposed to higher cholesterol levels. The bad goes up, the good goes down. We can put more fat around our waist, which we know is a risk factor. So it's not that menopause causes heart disease, but all the changes that happen at the time that we lose estrogen can raise our risk. We don't even sleep as well, as many women know.
I can attest to that personally.
Nobody gets out of that for free.
No.
But we know that, poor sleep or lack of sleep or inconsistent sleep is also something that we need to, address as far as, minimizing cardiovascular risk goes. So it's actually, as hard as time as it could be, it's a golden time to sort of double down on taking care of yourself, identifying things that you can change, what kind of tests you really want to have to identify early signs. It's kind of a golden opportunity for women, despite all of the challenges.
Yeah, no, it's eye-opening for sure.
It
It's
is
something
it
that
is.
I feel like
Yeah.
the older I get, the more I discover
I
something
know.
else. I'm like, oh,
Right.
That goes back to the pain threshold, right?
I know.
We even know that vasomotor symptoms, the hot flashes,
Yeah.
that can be women who have them more than don't. And usually that's familial. If your mother or sister had it, that can actually identify a higher risk for heart disease. So we don't want to ignore those things.
Wow.
yeah, interesting.
Yeah. What are some changes you could make, like lifestyle things that you can do if either you are at risk, either, or even if you're not, like how do you prevent yourself from and keeping it, and how do you keep your heart healthy, I guess is the real question that I'm asking.
Yeah, no, there's ways. And the good news is that it's never too young or too old to start, right? It doesn't require marathon running by, next New York City. It's small and consistent things. The American Heart Association has what we call the essential eights, life's essential eights. And the first four are health factors that we'd spoken about, manage your blood pressure, manage your weight, manage your cholesterol, manage your blood sugar. But the other four are health factors, features, things that we can do, and behaviors. So one is, quit smoking if you smoke, and that includes vaping. Secondhand smoke counts, so really stay away from it. The second is choose foods that are wise. And it doesn't mean you never have, fill in the blank. But every time you have the opportunity to eat whole fruits and vegetables, whole grains, not stuff in a box that looks like a chemistry lab project. Those are all the things. And again, small decisions. You got to move more. And that means standing up if you're sitting at your desk, walking 10 minutes, figuring out a way to just make movement part of your life. And the final health behavior is sleep. We used to be a source of pride that I don't need to sleep, it's a waste of time. Absolutely not. If you're not prioritizing your sleep, you need to. If you have trouble sleeping, then bring it up to your doctor. There's all kinds of sleep hygiene and other things that we can do. So those are some of the things. Figure out how to stress less. I know that sounds crazy, but maybe it's 5 minutes of mindfulness in the morning. Maybe it's laughing with a girlfriend. Maybe it's a dance party with your kids. All these small steps that make your heart a little bit happier and lower your risks. Think of them as things that don't stink, small things. Make a partnership with friends or family so you kind of hold each other accountable together.
Yeah, I think anything that you can do to reduce
Yeah.
stress,
Absolutely.
right?
Yeah, that's the hardest thing.
Women, we're so hard on ourselves. Cut yourself a little slack. If you have a couple of Girl Scout cookies, fine. Don't have the sleeve. Maybe tomorrow, right? We can't be perfect every minute of every day. It's
Sure.
consistent choices over a lifetime.
Yeah. And I think to your point too, just moving more, it's like people are always, I don't have time to exercise. You don't have to dedicate, an hour or whatever it is. Just move more, get up. Like I set an alarm now on my phone. Like if I'm doing a project and I know I'm going to be at the computer for a couple hours, it's like, all right, every hour I get up, I move. I mean, sometimes it's to go have a snack, but
Oh, you know what? And that's I joke with friends and patients. You showered today, your makeup's on, your clothing's clean. Decide that 10 minutes here, 5 minutes there, park farther away at this, when you're driving to some place. It's exactly. And
it
even if
all
you're
adds
getting up
up.
to get a custom, yep, it's getting up.
Right, it's getting up.
Definitely. Is there anything else? Before we came on, we were talking with you a little bit, and we had a mutual acquaintance and a very rare case, a young woman who had SCAD, or that's what it was diagnosed as, I think, right? And which just proves that you could be any age.
And she's 24.
And she's
She was
24 years
24.
old, had a heart attack.
And what's amazing about her story is, and sometimes we talked about the bad perfect storm, but when she developed these symptoms, she's smart. She didn't think, oh, I'll take a Tums. It's nothing. That she listened to her body. She knew something wasn't right. She and her family, asked the right questions when EMTs came, when she got to the hospital. They pursued it. They didn't accept, oh, nothing, it's 24-year-olds don't get heart disease or, heart attacks. So, it was a good example of being empowered, advocating for yourself, and expecting the right testing and diagnosis and treatment to follow up. But it is rare. And she's a wonderful spokesperson for
Yeah, she definitely is.
So in her case, and I happen to know her, and she leads a very healthy lifestyle and is, an avid exerciser and all the things. So was that something that she was genetically predisposed to have, or what are your thoughts?
Yeah, no, that's a great question. And thank you for bringing up the fact that don't assume if you're young, if you're athletic, if you're slim, if there's no family history, that it can't happen to you, right? So it's less common, but you're 100% of you. So part of the workup for someone like her is to look for other explanations to make sure that there's not some undiagnosed genetic something, and that testing's usually done, to dive deeper into your family history. Sometimes we know Uncle Greg had a heart attack, but maybe you find out that it was a tear in an artery or something else, just to see if there's any more history that you can gather. And then finally, learn as much as you can about what it is, how to manage it, how to get back to living your best life, and how to prevent or be aware of a repeat event.
Yeah. And what are the chances, just statistically speaking, of a recurrence of that?
Depends on what causes it. Spontaneous coronary artery dissection, which other of our women of impact have suffered. It's unusual. We used to think it was just during pregnancy. We didn't see a lot of it. So as we're learning more about how it presents, what the symptoms can be that are maybe a little unusual or different, whether there's some genetic predisposition, and how to navigate lowering the risk as close to zero as possible for a recurrence. What's unfortunate is that because it happens mostly in women, we don't have decades of science, and we're finally raising the questions. There's something called the SCAD Alliance and a whole bunch of now research as well as a community of women with this condition to really demand the treatment, the prevention strategies, and the research.
Yeah. Wow.
Wow.
Because I would think that, like, if that, I know for me, if that,
Oh
had
my
happened
God.
to
It would,
me,
I would be scared at every little
I'd be
anything.
and that's the worst thing. Because then
Yeah.
it's like, then you're
kind of living your life
stressed
in
out
fear
all the time. Yeah.
Yeah, and that's why when we talk about heart health and brain health, we want to put the woman, the whole woman, not just her heart muscle or her heart arteries. I just got off the phone with a colleague we were speaking about with a certain condition. Can you never exercise? Can you exercise to a certain heart rate, as we monitor on our watch, or so, because we want to look at the whole person. We want them to feel, psychologically well and active, and to get back to a full life, not just focused or paralyzed based on a single cardiac event. And I think that's what's so important, not just saying to someone, don't do this, don't do that, and making them terrified. We really want to look at the whole person underneath all of it.
Yeah.
Absolutely. It's so important.
Yeah.
So important.
Anyway, well, this was fantastic. You gave great information in a short amount of time, but you gave
well, it sheds a lot of light
It does.
in terms of the survivors that we spoke to.
Right.
And, it makes it, a little bit easier to understand why they went through what they went through, and how to A, prevent that, and then B, to not live in fear afterwards.
Exactly.
And advocate. These are strong, spectacular, gorgeous women that tell their stories. And we all feel, we can be a little like that and sort of get the message out.
Totally.
100%.
And American Heart does so much to
the American Heart Association,
spread the word. So we appreciate you
so important. Thank
coming
you.
on to talk about this with us and our audience.
Is there any last words you want to add, or?
Yeah, no, I'll just do a toss out. The American Heart Association website is fabulous, heart.org. It's a trustworthy site with practical tips for everyone. The organization is marvelous in our approach. We've got Research Goes Red, even a women's health venture fund to get more money into research and all of it. So everyone could be at risk. Every opportunity you have to know about your heart conditions and to make yourself heart healthier counts, and ask the right questions and demand the care that you deserve.
Yeah. And AHA puts on a beautiful red dress
collection, fashion show, music.
We had the pleasure of attending again this year, which was
lovely.
Fantastic. Yes. Such great, inspiring stories.
We thank the media, because this is how women, learn health information. So
absolutely. Yeah.
Thank you both.
Definitely. Thank you so much for being here. We really appreciate it. How extraordinary was that?
Oh my God.
Such a departure for us, but oh my God, so needed.
Yeah. So needed. And they are just, I love that they're all like friends.
Yeah. They just, they're from
unfortunately
all walks
this
of life.
brought them together, but from different areas of the country. And, I just think that those stories are so meaningful and so helpful for people to hear, like how many times do you dismiss something that's going on with you? This is a million years ago, and very different. I mean, I guess it could have been life-threatening, but when I was in my 20s, I was having this horrible, horrible stomach pain to the point where I couldn't stand up, and I kept saying it's just the flu, and I'm throwing up, violently throwing up. I'm like, not flu, it's just a stomach virus, whatever. And I remember, so it was 3 days of this, in doubled over pain, to the point where I was coming down the stairs of my parents' house, and I was crawling down. I had to sit down to go down the stairs. And my dad's like, get in the car, we're going to the doctor. And we go to the doctor. He's like, she needs to go to the emergency room right now. Oh, my God. I was having appendicitis at the time. Oh, my God. And so my appendix perforated. I was in the hospital for 8 days.
Jeez.
But I was just ignoring it. But also because I was afraid. I was like,
well, you're younger too.
And I was like, I don't want to. And then I remember going there, and they didn't know what it was. They were doing ultrasounds. Right. Is there any chance that you could be pregnant? I was like, don't say that in front of my parents. What do you mean? I'm only 24 or whatever I was at the time.
I don't have sex.
What are you talking about?
What are you talking about?
But so I think, just knowing that don't dismiss those.
Yes, and just
signs.
because someone tells you no, you know you. You're the only one inside you.
Yep.
And that is we hear that
all the time.
All the time.
I know.
In life and on this podcast.
For sure.
So go see your doctor.
Go to your doctor.
Listen to your body. We hope you learned as much and enjoyed listening to this as much as we did. I'm Lori Schulweiss.
And I'm Jen Gialmo.
This was Everybody Talks.
Talk to you next time. For more information about our podcast, to learn more about us, and to catch up on all of our episodes, go to our website at everybodytalkspodcast.com.
Follow us on Instagram at Shuli, at Jen Gialmo, and at Everybody Talks. And if you want to watch today's episode, go to our YouTube channel at Everybody Talks Podcast.
Join the Everybody Talks community by checking out our Patreon page, where you can become an exclusive member of our wellness group and be a part of the conversation.
And don't forget, if you like what you've heard, give us a 5-star rating, write a review, and tell a friend. We're for everybody and everybody. The Everybody Talks podcast is co-created, executive produced, and hosted by us, Lori Schulweiss and Jen Gialmo. Produced and edited by Station 16.
Our theme song music is written and performed by Jackie Ryle and Aaron Navisi, with additional support from our pups, Oliver, Milo, and Murray.
Talk to you next time.